I'm going to show you how to pick up the baby on Swaddle. Okay, normally you see that when we are not swaddle the baby because baby's their nerve system is not mature, so that's why we highly recommend to swaddle the baby till 6 weeks. When you're breastfeeding, you don't need to. So right now we pick up the baby, okay? So normally it's kind of hard to pick up the baby like this. I will highly recommend you turn the baby on the side. When you turn on the side, can you see it?
Mm-hmm.
And then you put your hands actually under the baby's neck. You turn the baby back, she's in your hand. See that? When you pick up the baby, you always put the head up because during the transferring, you will surprise she burp herself. If you hold the baby flat and air goes nowhere. So okay, now I'm going to pick up the baby's legs, okay? So right thumb, go to the left knee, forefinger, grab the baby's buttock, pick it up to the chest. Mommy's chest, daddy's chest is the best places, most safe place. So that's why you're probably using your chest actually to support the baby. So you can't hold the baby like this, right? So look at my left arm, we travel and hold the baby, and you hold the baby's head, and you can dance with the baby. That's the part I love my job. Okay, now I'm going to show you swaddle baby and put the baby down too in the same times, okay? Now, swaddle the baby, highly recommended swaddle till 6 weeks, right? So you fold it down one corner, and this will be the baby shoulder line and also the neck lines, okay? And then you put the baby in the middle. I have some tricks for you. Okay, now I'm going to put her down, right?
Mm-hmm.
Right down, hold it up the left knee, forefinger, you'll have to have a little grip. Don't let the baby actually sleep or rest on your hand like this. You have to have some grip. And remember, they're not that fragile. You're not going to hurt her. Okay, again, I'm backwards a little bit, put the baby on my chest. You see that? And then you move your hands like that. So remember your left hand, it's always on the baby's neck and the head to support her. Now I'm going to put her down, right? You lean down a little bit, always buttock down first. Okay. And then you hold your baby's head and neck and put it down. Okay. Those days we don't put the baby's arms on the chest anymore. Believe me, they are way too smart like used to be. At just second it come out. So we put it on the side. Now is the trick time. Okay. Sometimes the baby, they just don't listen to you to wanted to put the legs down. I mean the hands down. So what we're going to do, we're going to give her a little Pilates. Okay. See it? Up and down and up and down and up and down. See it? It's down. So you're holding this side. By the way, she's very strong. Okay, and then you hold it. When you hold it this side, you're using your two hands holding the blankets. You turn the baby on the side gently and you pull, then you tuck it in. Do not worry about it's too tight for them. Actually, even though the blankets is really tight, it won't be as tight as your uterus.
She had no room.
So, and besides they wiggles, so we don't worry. Okay, turn it back. You see here? Then you folding down in here. We want to here on the chest as a V shape because technically said baby they're afraid of hot. They are not afraid of cold. 2 days ago, especially first 24 hours, she sneezed a lot. It's because rejection. She need to get rid of the amnio fluids in her nose. It's not because she's allergic to the AC. It's not because she's cold. Do not touching baby's feet and the hand to determine she's warm enough. 10 years ago, we put our hand on the baby's lower back, but right now, totally different. We put your hand to under the baby's t-shirt, under the armpit to determine that she's warm enough or not. Because her feet, her hand is the far away than her heart, so four extremities are always cold.
Okay.
Got it. So then you put this on the side of her body, and I like to leave a little room for the baby able to stretch. Okay, so now we put this arm down. Same thing, resistance, up and down and up and down and up and down. Then you cover it up, two finger on the top, always turn the baby instead of you pick it up. And then you pull, then you tuck it in, and then come back. I know. Then you're stretching down a little bit. Okay, and then here, if it's not too much, then you don't have to fold it down. You decide it. Okay. When the babies sleep really well, for example, you just finished breastfeeding, 1 hour later, suddenly she's in the crib, she screamed like crazy. You know what happened? Mostly it's because gas pain. Because 1 hour ago, you fed her. During the digestion, she produced gas. Same thing like I tell you. The gas bubble actually sometimes travel till here, from stomach till the chest, and stuck in here. When you drink soda, you're stuck in here. You will be so painful. That's why she screamed. Instead of you approaching her and then doing this, it doesn't help. Pick it up. Now I'm going to pick it up and put on my shoulder. And you are so tall that when you put the baby on your shoulder, don't you feel like you're so worried her head, her neck will be dropped?
Yeah.
Right? So what we're going to do now is another trick. Turn the baby on the side, same thing. Left hand holding here, come back and up. Grab the whole things on the legs, pick it up to your chest. Okay, we're going to do it actually on the shoulder. So, you're tall, so you can actually put your left legs a little bit one step forward. You bend down your shoulder. You put the baby on your shoulder first, then you stand up.
Okay.
And then you're holding her.
Yeah.
The head goes this way, go that way, it doesn't matter. Then you're using your cheeks to hold her head. Okay, give me your arms. Your arm, one hand. Okay, I'm doing a little bit hard. Okay, this is slapping, painful. This is cupping. Which one is better?
Tapping.
Cupping.
A lot
So,
better.
I'm going to burping the baby. Okay, now this is too high. This is too low, the bottom. High and low in the middle. So you rest in here, and then you do this.
Tap.
This is the part I like it to can dance with the baby. Then you talk to her, hey, what happened? Why is so fussy? Don't worry, sweetheart. Everything will be good. And then you'll hear she problem solved. And for me, I will patting their little buttock. If she can give me a fart, problem really solved. Okay, so now feeding, burping. One burping is kind of like this, and the other burping is on sitting position. Sitting position, actually, you can do whatever you feel more comfortable with. And some nurses will show you hold the baby's jaw like this. Personally, I don't like it because put myself in her shoes. You want me to burp, but you hold my jaw. How I supposed to burp? Because secondly, she speak a little bit, she will kick. She kick, she go this way. One hand's holding her chin like this. The other hand you are ready to burp. And then when she actually push, kick, and you lost the balance. So for me, I really like it, which is my right hand holding baby's left face. So right always go to the left. And then I lean baby down. And then, so her weight is on my thigh and also on my arms. Cup shape. This is too high. This is too low. In the middle, I burp her. And I can actually see her face. So it's much better. So just remember, when you stay in the hospital for the 3-4 days, you have different nurses, different tricks, different things. Don't let don't let them confuse you. Just remember, if the stereo swallows makes sense, I would do it. Doesn't make any sense, she doesn't tell me, then I ask. If actually it doesn't make sense, you don't need to do it. Skill while, whatever you feel more comfortable and your baby feel comfortable, that counts. Okay, any questions? Turn it off.
Thank you.